Good morning. I'm Beverly May, Regional Director for the Western Region for Campaign for Tobacco-Free Kids. Thank you for being here today for Kick Butts Day. The Campaign for Tobacco-Free Kids is a leading force in the fight to reduce tobacco use and its deadly toll in the U.S. and around the world. We advocate for public policy proven to prevent kids from smoking, that is, funding comprehensive tobacco prevention and control programs, cessation programs, and protect everyone from secondhand smoke. Campaign for Tobacco-Free Kids is very excited to have over 1,200 Kick Butt Day events going on all over the United States and the world, including military bases today for the first time. With funding from the United Health Foundation that started helping us a couple years ago, we also have Oregon as one of our priority states today for CTFK's Kick Butts Day. The reason for that, Oregon has always been an important state. The advocates have always been very forceful in caring about the health of the people in the state, and we want the legislators to work with the advocates on this issue. This year, they have a chance to do it. Oregon has received over $1 billion in Master Settlement Agreement funding over the past decade, but not one penny has gone to be dedicated for tobacco prevention and control funding. This biennium, $120 million of Oregon's Tobacco Master Settlement Agreement monies will be unlocked, which means this money will be available from debt obligation and available for investment in Oregon's future. The release of these funds offers an opportunity for Oregon to finally use the money for the original purpose, and that is the advancement of public health measures. A broad coalition of Oregon's healthcare advocates have joined together to recommend investing Oregon's 2012-2014 share of the settlement funds into public and private health strategies that will invest in strategies to prevent Oregon's kids from ever beginning to use tobacco, delaying that onset of picking up that first cigarette or using chewing tobacco, and improve the health and increasing access to physical education and school-based health centers. The Kick Butts Day is a national day of activism that empowers youth to stand out, speak up, and seize control of big tobacco. I want to thank you, Oregon advocates, for doing the right thing. Now we ask the legislators to do the right thing and fund health strategies to prevent youth from smoking and help smokers to quit. Thank you.
My name is Marcia McGarry, and I'm a former PE and health teacher at Reynolds High School in Troutdale. I recently retired from teaching. I taught kindergarten through high school, most recently high school for 15 years. I am an American Cancer Society volunteer with the Cancer Action Network. My wonderful father-in-law started smoking when he went into the U.S. Navy in World War II. Cigarettes at that time were routinely given out with the food to help the men relax. He was told that as many cigarettes as he needed and his shipmates needed, they would receive. There wasn't the education at that time that we currently have to be able to know the harmful effects of the cigarettes. So he got hooked and he continued to smoke. He was involved in many kamikaze battles, which further enabled him to go on the ship with his friends, keep smoking, and when he came home, he continued to smoke. We had our first child. This is my son Colin, who was the apple of his papa's eye, and he has missed out on many activities in my children's lives because he's gone and we miss him. This is a Christmas. Before we knew the problems that smoking caused, my son smoked pipes with Papa. So we had no idea what it would be doing. It took a while for his cells to mutate and for a problem to show up. He began to see blood in his urine, and when he went to the urologist, they found polyps. They were from smoking. At first, they tried to go in through the urethra to the bladder and remove the polyps. The bladder cancer developed in the 1980s. It did not take long until he had to have his bladder removed, and he wore a bag. At age 69, he died in 1994. Here is a statistic. Of the adults who smoke, 88% started before the age of 19. Those are the high school kids I taught. That's why I find this very, very important that Master Tobacco Settlement Agreement money goes to the health of Oregonians. 99% started by the age of 26. Among those who continue to smoke, about half will die earlier than their non-smoking peers, losing about 13 years of their life. As an educator, a mother, and a daughter-in-law of someone who died from smoking, these are statistics that I cannot ignore. That's why I'm here. Oregon's children are faced with two huge public health threats. They're detrimental to the health and status of these children. Those are tobacco use and obesity. Left unchecked, these two issues will almost certainly cause immeasurable harm to the physical health of Oregon's youth, and later as they become adults. During my years as a health and PE teacher, I have witnessed Oregon schools continually try to be healthier. From providing healthier foods in our cafeterias to opportunities for physical activity, trying to save public school PE classes, and at RHS, Reynolds High School, we even removed the pop machines from our building. In 2007, Oregon's legislature recognized the importance of physical education for our students. And this Tobacco Master Settlement Agreement policy package helps us strive to protect those kids even further. It's important. Our efforts to build healthier schools, healthier communities, and a healthier state must not be stalled. This is too important to our health to do nothing. We need to spread the word amongst ourselves and then share with our legislators the importance of the proper use of this money. These policy recommendations for the Tobacco Master Settlement Agreement not only fulfill the original intent of the settlement, but they would also help reduce the burden of chronic disease in our state, producing a healthier generation of Oregonians. Oregon legislative session has begun, and legislators are now making decisions every single day regarding Oregon's budget and how that $120 million will be spent. This is a big deal, and this is important. So we know firsthand that active students are more likely to lead healthier and happier lives. We are going to reduce youth obesity and tobacco in Oregon. A greater emphasis must be placed on school-based health initiatives and tobacco prevention and cessation. We need to educate our kids in school. Investing in the settlement funds in the current and future health of Oregon will do just that. The money needs to be spent as originally intended, not to be sitting in or used by the Oregon General Fund. The intended use of these funds is to help Oregon recover from tobacco-related health care costs and prevent people from tobacco's deadly effects. Unfortunately, these funds have instead been used to cover Oregon's budget shortfalls and debt services. The money is not intended to bail out Oregon's financial crisis. Thousands of Oregonians die every year from tobacco use, and declines in adult smoking rates have stalled. I understand your reasoning that using the money from the settlement agreement for Oregon's general fund to pay Oregon's bills is an easy, immediate solution. But if you do that, you will eventually end up costing the state more money because more people will smoke and you have to pay the medical bills for future smoking-related illnesses. If we don't educate our youth, the cycle continues. They will smoke and incur the costs of smokers in the future. The medical costs will balloon. You will need to keep healthcare costs under control by educating our youth now. Tobacco use takes an enormous toll on health, lives, and money in Oregon. Investing in tobacco prevention programs will save lives and save money by reducing healthcare costs. Now is the time to guide Oregon toward a brighter tomorrow with healthier kids and more lives saved. Let us use that money for what it was intended in the settlement agreement: the health and tobacco prevention education for Oregon's precious children. Thank you for your support in building a healthier Oregon.
Hello, my name is Sid Swift. I'm a respiratory therapist student at Concord Career College in Portland. I'm here today to voice my concerns about the effects of tobacco use. I see too many of my peers and neighbors, both at college and in my neighborhood, smoking. It bothers me that an estimated 38,000 Oregonian youth still smoke. As a future respiratory therapist, I will be dedicating my career to helping those who are struggling with respiratory illnesses. Too many of these illnesses are preventable, caused that are caused by smoking. 87% of lung cancer cases and 80 to 90% of all COPD cases are caused by smoking. It is shocking to learn that the tobacco industry spends $8.5 billion each year, more than $23 million per day, to promote their products. And many of their products, their marketing efforts, directly reach kids. They spend $100 million each year in Oregon alone to market their deadly products. For example, tobacco companies continue to advertise heavily at retail outlets near schools and playgrounds, with large ads and signs clearly visible from outside the stores. Because of this heavy marketing, we need strong tobacco prevention programs in our state. We have seen how smoke-free policies work in the community, at our workplaces, community colleges, and universities and other settings. These policies protect everyone from secondhand smoke and deter smokers to continue smoking. They are a great example of why we need to increase funding and important programs like Oregon Tobacco Prevention and Education Program. It is time for Oregon to spend revenues from the tobacco industry on tobacco prevention and other public health initiatives. Thank you.
The end.
That's it. Is there any questions?
I got a couple of questions. I know that the governor's budget proposes to put this money into healthcare. Are there any differences between what the coalition proposes and what the governor does now that the bond payments, I think, end in September of this year?
Would you like to take this step?
You have to answer up here. I'm sorry.
Hi, I'm Stephanie Thomas-Sweet, Director of Government Relations for the American Heart Association. So the governor's budget, they allocated $120 million to the Oregon Health Authority, and our understanding is that those funds are specifically dedicated to the Medicaid budget, the coordinated care organizations. So a portion of our campaign reflects what the governor's budget did in that we do support that it's going to the Oregon Health Authority budget and to health concerns, and obviously also support going to the Medicaid, a portion going to the Medicaid population, but we are very concerned that not one penny of those funds have been dedicated to tobacco prevention or cessation benefits.
Okay, so your aim is to earmark at least a portion of that this specifically for tobacco cessation?
Yes, our ask is for $12 million. It's 10% of the Tobacco Master Settlement funds, which is a very reasonable amount, and frankly, with no pennies going there in the past, we think that's a reasonable ask.
The other question is related, although not to the tobacco settlement funds. There is a proposal that I believe the House Revenue Committee heard recently about raising the cigarette tax to $1 per pack. and I believe there are a couple of the member organizations in the coalition that support that. Is that also the position of the other groups involved?
Well, I think I'll take a stab if anyone else wants to. I think one thing I would like to add to the last question, if it's okay, I think that it's really important to understand that the Medicaid population is a population that rates are very high in smoking. And I know the governor is very concerned about a healthy state. And so working with the Medicaid population on tobacco prevention and having cessation programs is going to be a saving for the state. And most people that are smoking want to quit. So that's why we certainly want to see this funding going to tobacco prevention and control. As far as the cigarette increase, we certainly like to see a tobacco increase at any point. Anytime the increase happens, it's a sensitivity for youth when it comes to price, and that delays youth from smoking. But it's always important when there's a cigarette tax increase that a portion of that funding goes back in tobacco prevention and control. And there's two reasons for that. You want to make sure you always have a comprehensive tobacco prevention control program in the state. And you want to make sure when you raise that tobacco tax, the people that quit, you have the cessation programs in place that you can help them quit. You just don't raise the tax, want people to quit, and they don't have any money or any help to get them through the addiction that the tobacco industry has caused. Would anyone else like to add to that? Okay.
Those are the only questions I have. Just afterward, I just need to get the names of some of the speakers.
Okay.
Stephanie, I have yours here.
Okay. Anything else? Thank you.